Assalamualaikum. Hello everybody. I am Dr. Gulzar Ali, Assistant Professor NICT Karachi. Today my topic is hard topics for last almost 1 to 2 months, which is Monkepox virus. So first of all, I little introduction about Monkepox virus. What is this? Monkepox virus is the DNA virus that belongs to the Orthopoxvirus genus of the Pozviridae family. And Orthopox genus is also include variola virus, which causes smallpox. You all know smallpox. The first case of monkeypox virus infection was recorded in 1970 in the Democratic Republic of Congo. After that, there is a number of outbreaks in the Central Africa. In Africa, there are two clades. One is Central Africa, you can say Congo Basin, which is more dangerous, more severe, and other one is the West Africa clades. So in whole other worlds, especially nowadays in the Europe, this virus is from the which one? That one is the West Africa clade types. So that is a mild form. So it's always blessing from God. That's those diseases widespread. That's in the mild form, and those diseases which is very aggressive that occurs in the limited areas. So how it is transmitted? Research is still going on how it is spread, but monkeypox is a zoonotic disease. In fact, human occurs through contact with the animals. Which animals? Rodents, squirrels, or primates. You can say rats, and in Urdu, squirrels, gilari, or apes and monkeys. So virus how enters in the body? It enters by either through respiratory tract or mucous membrane or skin broken skins. Contact with the animals mucosa, animals infected areas by human mucous membrane or broken skins. So in human to human infection occurs direct contact with infected person's skin lesion can transmit respiratory droplet like other viral infection, can placenta from mother to fetus. Placenta is the source. It can and of course direct sexual contacts. So what is the there are three types: suspected case, probable case, and definitive case. In suspected is which case we suspect: high grade fever, more than 38.3 degrees centigrade, with unexplained rash, and two other points like severe headache, body ache, myalgia, intense asthenia, or lymphadenopathy. So 2 points with rash, unexplained rash, and high grade fever. This is we call suspected case. And what is probable case? Suspected case with one more points like epidemiological link, travel to that epidemic areas, or multiple sex with multiple partners. And what is the definitive case? Suspected case with microbiological evidence or laboratory findings. We call it is the confirmed case. So skin eruption, how skin eruption occurs and where it occurs? It occurs almost 1 to 3 days after your appearance, and first on the oral mucosa, then on the face, and spread on the extremities rather than on the trunks. Lesion involved into palms and soles, and conjunctiva or genital, conjunctiva 20% and genital in 30%. How rash evaluate? How rash spread? So rash evaluate from the macules like lesion with flat base to papules, slightly raised lesion. Vesicles, what is vesicle? Lesion filled with clear fluid. Pustules, lesion filled with the yellowish infected fluid, and then crust, and finally that crust dry up and flakes off and skin will be generated. So possible but rare. Though these are the rare but possible complication. Pneumonia can occur, secondary bacterial infections can occur, sepsis, encephalitis, inflammation of the brain. Keratitis, it's dangerous. Keratitis, it can lead to loss of vision, miscarriage, or very rare it can cause death. And possible long-term sequelae, again scarring of the skin, reduced skin pigmentation and blindness. So what are the differential diagnosis? Every disease have a differential diagnosis. So what are the differential diagnosis of this disease? Any when this disease starts from the non-specific symptoms like fever, body ache, rash. So any disease which causes fever, body ache, rash, it will be the differential diagnosis of chickenpox. But some close differentials are the chickenpox and smallpox, especially those patients can suffer from the chickenpox, but those that are not vaccinated. And other are COVID-19 infections, which is also recently, just past few years, was most common. So still in a lot of areas of the world, COVID-19 can occur. And even complication of or adverse effect of the COVID-19 like fever, body ache and lymphadenopathy. So you can keep differential diagnosis of chickenpox, COVID-19 infection as well as adverse effect of the COVID-19. Other like bacterial infection, staphylococcal, streptococcal, scabies, especially of nodular form, mycoplasma pneumonia, molluscum contagiosum, or drug-induced reaction. These are the some common differential diagnosis. How we laboratory diagnose this? So every test, first of all, how we collect the samples. So first, before the collection, proper PPE should be, multiple specimens should be taken. Or where from the specimen we should, from the mucosa, from the skin aberrations or secretions like body fluids, and multiple symptoms, multiple samples should be collected, and even skin biopsy, you can take skin biopsy. Sample should be stored in between 2 to 8 degrees centigrade. Today's my lectures, my video mostly related to health workers like doctors, staffs, or those who are highly educated. They can keep on studies, keep on knowing the latest topics on the YouTubes, Googles. They can understand this video. So first of all, every case we all should take the responsibility. Every case should be reported to responsible authorities. Now management, how we manage the case. So first of all, before management, I would like to say this chickenpox is very mild infection. Majority of the cases mild infection, especially those type of infection which come from the West Africa. So first of all, you should reassure the patient, reassure the family that this is a mild form and it will recur mostly between 2 to 4 weeks. Admission criteria, though it's very rare, some patients develop severe infections, especially those are immunocompromised, old age, children, and those who have other disease. So which patient we will admit? What are the admission criteria? So adult, those patients who cannot self-isolate, so we can admit him. Patient requiring other admission criteria like more than 2 to 3 comorbidities, diabetes, renal disease, liver disease. So these type of patients, if developed monkeypox infection, should be admitted. Pregnant ladies, children below 6 years, or elderly more than 70 years, and those patients who develop eye lesions. Remember, eye lesion can lead to blindness, and patients require admission for some other reason, so also admitted for chickenpox. Now supportive care, I already mentioned supportive care. What is the supportive care? First of all, again I am repeating, reassure the patients, families, and some guidance. It will mostly require 2 to 4 weeks. So first of all, patients, those who are dehydrated, ensure the hydration, hemodynamic stabilization if develops dehydration, IV hydration or nutritional supports. Give antihistamine or calamine lotion if rash is itchy. And in case of gastrointestinal symptoms, Minimal fluid loss should be the goal. So oral or IV anti-emetic medications, antidiarrheal medication. So fluid loss should be restricted. If secondary bacterial infection, that should be treated, and ocular management is mandatory. So what is the definitive treatment is antiviral agents and vaccinations. So before infection occurs, we should prevent the infections. How we prevent the infection? Infection recognition and source control, preventing spreads. People should be knowledge about the prevention program, and everybody should involve this. So standard precaution, contact precaution, droplet precaution, and airborne precautions. First of all, we start from the hand hygiene. Like we already see and make the lot of videos on the COVID-19. So what hand hygiene, proper hand hygiene is the first step. Second, if any health worker or any other workers which come in contact with the infected, so personal protective equipment, proper personal protective equipment should be there. And after that, every gown should be disposable gloves, respiratory protection, eye protection like goggles or face shields should be correct. How we transport the patients? If we detect the patient in peril, how we transport? We should en route that way where crowd should be less. Always notify the receiving sites, and all transport personnel might come in contact with patient should wear the PPE. And patient schedule, if we are in hospital, we are scheduled to any procedure to that patient should be on the last to list. So proper cleaning and disinfection should be made. Environmental control. How environmental control? Cleaners, those who are cleaners should wear appropriate personal protective equipments. Cleaner must be educated, and those who are containing clothing, linens, baggage, they should be cleaned. And proper technique and proper methods. Okay, so if you are boiling the cloth or linens in house, so the boiling temperature at least over the 60 degrees centigrades to boil to wash the clothes. And handling of the, like if some patients, if any patient expire, how we handle the deceased body. So all postmortem procedure include body washing of the deceased persons, and any person who are involved in this should be properly wear the PPE. Body should be prepared following the routine healthcare facilities. Persons who handle the bodies should strictly wear the PPEs, and even after the final process is completed, he should check any remaining, any secretion, any touch surface area should be properly cleaned. And now we come on the isolation. If anybody interested in home isolation, so how he home isolate, he should wear the mask at least. If he is not able to wear mask like child, then other family member should wear the mask. What is the duration of isolation? Average duration is 2 to 4 weeks. It may be reduced or it may be prolonged. Exposure risk. How you are at risk, how you know? So there's no risk, no known contact, no risk, no surveillance is needed, and no recommendation needed. Low risk, healthcare workers who are properly equipped, properly wear the PPE, and if they are in context, they are at low risk. So they should be there should be surveillance, but no any recommendation for the treatment or vaccination. Intermediate risk, those who are even properly PPE protected, but incidentally some secretion or some points are contact to the body, so they should be there should be surveillance as well as post-exposure vaccination. And what are the high risk? High risk are those are who are directly contact with skin, infected skin, mucus secretion, or punctured by sharp objects through the contaminated gloves or materials. So these again should be surveillance and post-exposure vaccination is needed for these types of health workers. Okay, and now information for last but not least veterinarians. Those who are veterinarians, they are directly treating the animals. So there should be proper counseling, they should be properly equipped with PPE, and every animals they are treating, they suspect the infected monkeypox infected virus until unless proved otherwise. And veterinarians should know the proper guidelines, proper handling techniques, and they are more risk. And finally, what are the treatment? There are two treatment options, either drugs, three drugs and two vaccines are available in the world. First drugs, oral drug is you can call this the teicoviramates. It's oral drugs and weighing patients at least 13 kg. So if you want to know the dosage, if patient is 40 kg and less than 120 kg, so 600 milligram BID for 14 days. If more than 120 kg, then 600 milligram. 600 milligram per hour 3 times a day for 14 days. And for IV, again duration is for 14 days, but dose is the 200 milligram IV for less than 120 kg and 300 milligram for more than 120 kg. But in IV, you should measure the creatinine clearance. Creatinine clearance, if less than 30, then IV is contraindicated. Second drug is the cidofovir. It's antiviral, you all know cidofovir. It's antiviral drugs which was previously used for the other pox viruses. So third drug is the brincidofovir. It's the pro-drug of the cidofovir. These three oral drugs and two are the vaccines for the chickenpox in some parts of the world is available. So one is a live vaccine, that is a replicating smallpox vaccine and named as ACAM 2000s. And the second one is also you can say smallpox and chickenpox virus. It's a live but non-replicating virus, vaccines, and its name is genus. These two viruses and three oral drugs. So I think today in this video I have covered a lot of topics of the monkeypox virus, and from my point of view, a little bit knowledge about the health workers, our colleagues, our nursing staffs, and especially for veterinarians and those who are cleaners. So if you like my video, so kindly like, shares, and do share with your colleagues and in your any social media accounts like WhatsApp, YouTube, LinkedIn, and know me in your prayers and remember me in your prayers. Dr. Gulzar Ali. Bye bye. Allah Hafiz. Take care.